Welcome back to the David Pakman Show.
All right, back on the David Pakman Show. Make sure that you are subscribing to the David Pakman Show membership program. You'll get this podcast completely commercial-free, as well as the bonus show and access to our full archive of shows. It dates back to August of 2005. I would ask, out of just a favor, the stuff before 2007, there's no need to go and listen to that. You're not going to find anything interesting. You're not going to find anything embarrassing in that. It'll just be, it's better to stick to the newer stuff, right, Lewis?
Yeah, why not?
New study suggests that doctors often wouldn't follow their own advice. I read this thing a couple of times to really try to figure out what's going on. And when it came to their own well-being, a large percentage of doctors chose a different treatment option, research shows, than the one they would choose for a patient. And what it means, I'm still not completely sure. So physicians who were surveyed were more likely to choose a treatment in which they were more likely to have long-term repercussions, such as paralysis, rather than where death was more likely. But when it came to advising the patients, doctors were more likely to choose the treatment with a more likely chance of death versus one with non-lethal but still serious problems. What do you think of that? This, by the way, is going to be published in the latest issue of the Archives of Internal Medicine. That's the source.
Yeah, I think I'm not surprised at all. I think in a lot of cases, the more logical decision is the one they give to the patient. You know what I'm saying?
Rather than for oneself.
Right.
Well, Dr. Peter Ubel, who's a physician and behavioral scientist at Duke University, said doctors and patients both need to just be aware that advice giving is not as neutral as they think. This is not just about experts handing down expertise. It changes the way people weigh risks and benefits. A better approach would be for both of the groups, doctors and patients, to have a better discussion of what matters to the patient. So this is pretty interesting how they did it. They had two scenarios that they presented to the doctors. The first one, doctors had been told that either they or a patient had been diagnosed with colon cancer, and they could choose one of two surgeries. Both options had an 80% cure rate, okay? One had a higher death rate, but fewer side effects if you don't die. The other had a lower death rate, but patients were more likely to have significant side effects, a number of different things. So when it came to their own bodies, the doctors, about 40% of the time, chose the option with the highest death rate and fewer side effects. And then 25% of the time, they thought that patients should do the same thing. 15 percentage point difference, not insignificant. Does it show a huge bias between choosing for oneself and for others? I don't know. I guess that depends. Is 15 percentage points a lot?
Doesn't seem like it.
It's not insignificant.
Right.
The second scenario involved being infected with a fictitious new strain of avian flu. The flu itself had a 10% death rate if you do nothing, and it would send 30% of its patients to the hospital for an average of a week. The one treatment would halve the rate of adverse events, but it would kill 1% of recipients and cause permanent paralysis in 4%. Okay, they surveyed 700 doctors on this one. 63% said for themselves, they would just stick it out and endure the flu rather than get the treatment. But for their patients, only about 48% said that they would recommend foregoing the treatment in the event of an infection. So for patients, they were more likely to recommend the treatment, even though it had side effect and adverse risks.
Mm-hmm. But we're still looking here at a similar percentage in terms of the difference.
Between the two scenarios, yeah. The real question is, when you think about which is providing better care, the opinion for oneself from a doctor or the opinion for a patient from a doctor. Not being a doctor myself, it's very hard to really understand the nuance of what's going on psychologically in this situation.
Right, right.
It is interesting, however, and I wonder with other scenarios, I wonder what other types of scenarios the difference would be more significant or less significant. In other words, I would assume that with orthopedic type of stuff, where it's a pretty straightforward, this is what's wrong physically with your leg or your arm, and here's the how you fix it. I would assume that maybe the numbers would be more similar between what one would recommend for oneself and for the patient.
Probably, yeah.
With other things, maybe involving experimental treatments or that type of thing, I feel like that's where there's much more opportunity for really a big variance between what a doctor would say they want for themselves versus for their patients. I could be totally off on that.
I mean, what's the rate of death on, knee replacement or hip replacement, right?
Well, any surgery with anesthesia has that risk.
There's that risk, but I mean, it's tiny compared to
the number of procedures that are done.
Yeah, and the things they're using as examples in this study.
Would it make you uncomfortable to know that what your doctor is recommending for you may be different than what they would recommend for themselves? In other words, would you be if you were aware of that?
I would want to know what the doctor would do for themselves.
You would.
I mean, I would ask it.
I assume if you ever asked the doctor, they would say, well,
what he would suggest for one person might not be what he would suggest for himself because of the state of that person, taking into things like their age, their health, whatever.
This study accounted for that, though, by making it a little bit more general than that. Right. It wasn't accounting for. I don't know. It's something. I think it's inevitable that you will have this discrepancy no matter what. Does it make me nervous? Does it feel like I'm going to get poor treatment at the doctor? I hope not. I mean, there's enough to worry about in the healthcare system already. I don't want to also be worrying about, is my doctor recommending different treatment for me than he would for himself? The other issue that is not even discussed here is that many times the treatment course that is determined, sadly, by ability to pay, quality of insurance, and access to care. And I know it's not part of the study, but it's very hard given the insane healthcare situation that we're in the United States to just completely skip that. I mean, we did for a few minutes to discuss the study, but I can't. I'm compelled to mention it for sure.
Mm-hmm. I think overall, get multiple opinions on anything when it comes to tough medical decisions like this. Not that they're going to vary, but why not?
Yeah, no, they may vary. But again, we're not talking so much about different opinions from doctors about what they would do to you, but rather the discrepancy in terms of what they would agree to for themselves.